Welcome back to part 3. We're almost done. So we left off here at thrush. So thrush or oral candidiasis is the fungal infection of mucous membranes of the mouth. There's white patches that may extend into the esophagus, and nystatin is a example of this. It can be given troche or suspension. So troche is a small lozenge designed to dissolve between a person's cheek and gum over a period of time, typically around 30 minutes. As the troche dissolves into the patient's mouth, the medication is absorbed through the oral mucosa and gradually absorbs into the bloodstream. For the administration of the suspension, it is held in the mouth. The patient will swish as long as possible before swallowing. And then also the intestinal candidiasis, the nystatin is a tablet and it is swallowed whole. Medications to treat intestinal parasites, anthelmintics, kill intestinal parasites such as roundworms, tapeworms, and pinworms by affecting the nervous system of the worm. It paralyzes the worm. It also can prevent the worm from absorbing glucose. So laxatives may also be given to expel the dead parasites in this situation. It's interesting to note tapeworms do not enter the actual tissue of the host, and albendazole is an example taken by mouth of a parasitic medication, and roundworms do enter tissue, thus they are more difficult to kill. Ivermectin is an example of a medication that would be used with the roundworms, and that is taken by mouth. Medications to induce vomiting and treat drug overdose. Emetics may be given to expel harmful ingested substances. However, vomiting may not be beneficial, so it's important to take that into account. The physician will look at each individual situation, as well as if you're at home and a harmful substance has been ingested, you want to call poison control. The number is provided here, 1-888-222-1222 is the number for poison control. So syrup of ipecac, this induces vomiting in 80 to 90% of patients within 20 to 30 minutes. It is controversial use at the present time. You can look more into that. It also may cause more harm than good. So again, these things are weighed before utilizing the medications. Activated charcoal, this attracts toxin and inactivates poison. So poison is then excreted in the stool, and this is used often with the drug overdoses. Let's talk about some startling statistics about opioid drug overdoses and how they're increasing in the United States. So from 1999 to 2017, more than 702,000 people have died from drug overdoses. In 2017, more than 70,000 people died from drug overdoses, making it the leading cause of injury-related death in the United States. Of those deaths, almost 68% involved a prescription or illicit opioid. Okay, so I'm going to read that again. So basically, I'm going to start with 2017. In 2017, more than 70,000 people died from drug overdoses, making it a leading cause of injury-related death in the United States. Of those deaths, almost 68% involved a prescription or illicit opioid. So far too many people are dying from drug overdoses, and over 50% are related to opioids. So we have an epidemic and a problem, and we need to be part of the solution in the future by educating patients on the risks and the side effects. A good example, I was really glad to see my daughter just had her wisdom teeth pulled out, and the oral surgeon was very clear about the possibility of addiction with the painkiller and gave a prescription but asked it not to be filled unless it absolutely needed to, and then also educated on the addiction problem that we have. So I was happy to see that it was addressed and we were educated on that, and that we were also encouraged not to fill the prescription unless absolutely necessary. So Narcan is what's used in this case. It blocks the effects of opioids and it can reverse the overdose. So you've probably heard that many police and fire companies are carrying Narcan on board in order to be able to save lives. Narcan is available in a nasal spray. It's also injectable. The naloxone comes in syringes or auto injectors, and naloxone is available over the counter in many states. Other states do require prescriptions. And I did a little bit of research and came up with that California is one of 41 states that have legalized the over-the-counter sales of naloxone. Just an interesting point there. Moving on to nutritional supplements. So malnutrition is caused by lack of food, excessive dieting, poor dietary choices, or illness that reduces the appetite. Antiemetics can improve nutritional status, and nutritional supplements compensate for lack of vitamins in foods. Boost, Ensure, or other store brands of liquid supplements can be used in this case. Digestants. Some patients have trouble digesting food because of food allergy or a genetic disorder. And patients with cystic fibrosis lack the digestive enzyme produced in the pancreas and thus require digestants. And digestants are digestive enzyme supplements, and they require this if they have the cystic fibrosis. They require it with every meal and snack for their whole entire lifetime. So oral treatments such as mouthwash can decrease halitosis. Halitosis is bad breath, or stomatitis, which is the inflammation of the mouth. And fluoride preparations can prevent tooth decay by hardening tooth enamel. If a patient does not produce saliva, sometimes saliva substitutes are available for that patient, and oral topical anesthetics can be used for teething pain and for mouth ulcers. Hydrogen peroxide can be diluted and used as over-the-counter weak antibacterial wash, and dentifrices, which is toothpaste, are used to clean teeth, decrease plaque, and prevent gum disease. That concludes our lecture, and this is actually our final lecture of our class. Next week, you'll really be focusing on mostly review. You'll be reading a couple of chapters for information only, and then working on review. So woohoo! Congratulations! You did it. You've been doing an amazing job. You can see how important all of this information is for you to take with you into your careers. And that's why for your final, you're making your notebook with all of the different classifications of drugs and side effects. And hopefully you will take this information, and depending on where you are, you will really concentrate and focus on the medications and the systems that you work with. And then down the road, we usually make changes in our career and we move to other places. So you'll have this as you go into different specialties. And again, you'll take that responsibility to go back and really look at the medications that you're working with. I've really enjoyed having you online and in class, and thank you so much. Congratulations and have a great day. Bye-bye.